So now I will request Dr. Irfanullah Khattak to come for his presentation.
The opportunity to speak on this platform. So I will talk about the epidemiology and of the pediatric cataract. So for my residents, the term epidemiology, we all scary from since our 4th years because whole of the community of ophthalmology revolves around this one topic of epidemiology. But it's not that much confusing. Though the word sounds complicated, but this public health specialty is easier to understand than we might think. So it is the field of medicine, epidemiology, which studies disease outbreak, its incidence, prevalence, and patterns, and to explain the causes and spread of pathogens in the community. Epidemiology helps to determine the causes of disease, its frequency and prevalence, and the pattern of transmission in the community, and the extent of risk of the disease to the community, school, or whole world. It will not only study the incidence or prevalence, but it also involves finding means to control the spread of diseases. So now coming to the pediatric cataract, a serious concern. Pediatric cataract is a serious concern. Why? Because it is one of the leading cause of blindness worldwide. And the important thing about blindness is increased blind person years. It's not only the numbers of pediatric cataract blindness, but a child have to live a long life of 60 to 70 years. So, and the socio-economic effects are enormous of childhood blindness. So that's the reason, that's why it's important. So I will share the demographics internationally and nationally and try to the statistics of our department. The pediatric cataract is one of the leading causes of childhood blindness, and its incidence ranges from 1.8 to 3.6 per 10,000 child per year. There is difference in the different community, different countries, and while the prevalence is about 1 in 10,000 children. We can see that the prevalence range is very huge from 0.3 to 22. This is basically a difference in studies of different community, different inclusion criteria, definition of pediatric cataract. So, but the median is one child is affected from pediatric cataract per 10,000 population of children. So the in different studies, the prevalence is higher in low-income communities compared to that of high-income communities. The prevalence in low-income communities is basically because of few factors. One is the maternal infection, especially touch infection, which is now controlled almost in our countries, but still it is occurring as compared to the developed countries. And the other is consanguineous marriages in our society are less developed countries. With respect to laterality and gender, there is no predilection for congenital cataract. There is no difference in male or female. In one study, approximately 1 to 15 per 10,000 children worldwide is accounting for, which account for 5 to 20% of childhood blindness worldwide. Globally, about 200,000, it is 2 lakh children are blind from bilateral cataracts. Remember, it's a tip of iceberg because it includes only the children with blindness less than 360 in the better eye. But the real magnitude of pediatric cataract is very high because of this number is less because of good management of pediatric cataract, and unilateral cataract is not included in this because the better eye has good vision. Apple et al. Stated that about 20 to 40,000 new cases of bilateral cases are reported diagnosed each year worldwide. This study is in 2000, now it will be almost tripled or quadrupled. In American Academy, there was a study in India in which approximately 10% of childhood blindness is caused by cataract. And there, in the same study, different pathology, different etiology was caused, and traumatic cataract was 11.6%, almost same or less than our society. So non-traumatic cataract, which includes all of cataracts, they were 88%.
This 10% figure is about congenital cataract.
Congenital cataract, there's 10% total blindness in pediatric population, and 10% is due to congenital cataract.
And then you can aid this traumatic cases.
Traumatic cases, this is just.
One more comment, if sorry to interrupt. Cataract is a leading cause of preventable childhood blindness.
Exactly.
So you should add preventable. And
Okay.
Secondly, when you define a blind, it is the best corrected visual acuity of 360 in the better eye.
In the better eye, that's.
Yes, best corrected visual.
That's why I explained that unilateral cataracts and
you
managed
choose the
cataracts
best
is not
corrected.
included.
We have to correct it and then.
Exactly.
So it means that it goes to 22%, almost 21 to 22%.
This is the blindness. These are blind children.
Congenital cataract and 11.6% traumatic cataract.
These are two separate
No,
studies.
actually
These are two
Yeah,
separate
yeah,
studies.
this is-
This is just different etiologies.
Acha.
The first one, because they are claiming it in India, must be a national survey of India, something like that.
Yes.
Is it the second?
The
last one is probably just,
it is just a hospital-based study.
okay, these are hospitals.
The first is hospital-based, and the second, and the first one is India national prevalence.
Actually, if you add the two, the 88, one other, so it says that among the 10%, the 10% is the total number of
No, no, these are two different studies, sir.
Non-traumatic are this one and traumatic are this one.
Sir, this is totally different, separate studies.
Actually, it is the presenting visual acuity, not the best corrective. It is the presenting visual acuity, because if you are talking about the best corrective, then it is out. So
No.
it is nowadays.
No,
it is
just to see,
defined as-
just to learn, it is very important.
Yes, my apologies. If they can.
At
we
the
can
end,
proceed
it will
with-
be questions.
Yes, at the end we can just.
Actually, then we will forget that. Now, see, we are old people. We want
So-
to make no.
Clarify a
Yes,
point that-
Salona, actually, we want to make it interactive. That's the reason.
Thank you,
Hello.
madam. There is a study, hospital-based study from Rawalpindi in 2014. They certain different. They said that there is bilateral cataract was 85%, while unilateral was 20%. This is a hospital-based study of 112 patients, and they said that consanguinity was a significant risk factor for congenital cataract, especially in bilateral cases. Unfortunately, there is no national level survey or on pediatric cataract or due to blindness of pediatric cataracts. So these are the magnitude of the cataracts, while in, globally there is childhood blindness is only second to adult cataract is a cause of blind person years. Approximately there are 70 million blind person years are caused by childhood blindness, in which 14%, which is 10 million blindness person years, is due to childhood cataract. Now we will share our departmental statistics. This table shows that in 2021 our pediatric unit of Hyderabad Medical Complex conducted major surgeries of 580. And this we can see that almost 340 out of 580 was directly congenital cataract or pediatric cataract. And another, not to my surprise, but this was repair trauma. 101 cases of trauma repair. Eventually, half of 2/3 gone to the traumatic cataract. And the surgical capsulotomy or secondary IOL implantation related to the congenital cataract or pediatric cataract. Similar statistic in 2022 till August. In 2021, a total number of 342 surgeries were done specifically for childhood cataract, which account for a large amount of 59% of the total surgeries performed, major surgeries. I am talking about the major surgery, which is for 60% almost related to pediatric cataract. And 2022, it increased further, almost 65%. So this data also reveals that the amount of primary repairs done in population below 18 years old, which were almost 17%, 101 cases, which also presented with complications such as traumatic cataracts, and we deal with further removal of cataract and implantation of IL. In addition to these major surgeries, 469 minor surgeries such as ROA, CUA, scraping or probing sending was done in 2021, and in this year it is to 324. Almost half of these cases was directly related to cataract, such as removal of sutures after cataract surgery in peds, or EUA for confirmation or refraction. These procedures not only resulted in increased workload on the department, but also had huge financial implications towards the hospital and the families of these children. This table shows that we ascertain from our data that less than 3 years of age of cataract, they were 373. And while from 4 to 15, it was 181. So 57% was congenital cataracts, while developmental cataracts was 26%. We retrieved traumatic cataract is a separate, which was almost 93%. At least we defeat India in this. 14% of cataract, total operated cataract was from trauma. This shows that majority of the cataracts is congenital type. One of the possible reasons and explanation for this skewing of data towards the congenital cataract is that majority of developmental cataracts are operated at district levels or in or other adult units, thus reducing the influx of such cases into our pediatric department. So maybe there is, in the community, there is increased developmental cataracts, but in our statistics it shows 1/3 of the this total cataracts. Remember, this does not include our private clinics patients and IBP patients. So almost it will be more than double. So now we will talk about the financial impact of the congenital cataract, pediatric cataract management.
One more thing, firstly I would congratulate Professor Naeem that so many pediatric cataracts were done in HMC, and I think HMC is on the top in TTK.
Thank you, madam.
Important thing, what I would suggest is that the follow-up of these patients is important, because to check their refractive status and to check the IOP. So
Exactly.
this may be seriously considered.
In fact, pediatric cataract is the only in which secondary and tertiary prevention,
Yes.
Tertiary prevention is more important, which is amblyopia therapy and complications like sir mentioned glaucoma, phakic glaucoma, cataract related glaucoma. So pediatric cataract.
कहानी सर्जरी के बाद शुरू
Exactly, sir. Pediatric cataract has huge financial implications as well, and it impacts not only the health budget of our country or province, but also the family having the ill child. So if finances are arranged, there is another concern, which is resources, which presents human resource, which presents another serious concern, especially at district level. A recent study, according to the finances conducted in India in 2022, published in Indian Journal in PubMed, that the average cost for one pediatric cataract surgery is approximately 22,000 to 28,000 Indian rupees. Now think about cost in Pakistani rupees, triple. One Pakistani rupee is equal to 3 Indian.
1 Indian rupee is equal.
Sorry, 1 Indian rupee. Although a higher number of surgeries and OPD patients reduce the fixed facility cost, but studies and demographics still show that pediatric cataract surgeries are cost intensive. For me, our society, it is the travel cost which is most, because in hospital, where far-flung areas, they come from far-flung areas, and now the travel cost is increasing day by day. Therefore, there is imminent need of technological and economical reforms regarding this grave issue. Psychosocial impact. Children who are blind have to overcome a lifetime emotional, social, and economic difficulties, which affect the child, not only the child, but the whole society and their family. Loss of vision in children influences their education, employment, and social life. Remember the numbers of blind with cataract. It does not, you do not reflect the years of disability and lost quality of life.
Do not reflect the use.
Do not reflect means एक बंदा numbers is not reflecting the quality of life.
समझ आ गई.
हाँ.
वो रिफ्लेक्ट नहीं करता कि blind years
Blind years कितने पर. Cases have been reported of children suffering from various forms of psychosocial disorders. A study done in Bahawalpur in Bahawal Victoria Hospital published in 2016 that 55% of children in blind school, they feeling depressed, there is feeling of guilt, sadness. So psychosocial impact is very important of childhood blindness because of, and cataract is one of the leading cause. This is etiology which will be discussed in the next presentation with detail. Among these horrific statistics, one good news is that it's a treatable cause. Pediatric cataract is a treatable, that's the good news. And the surgical removal of lenses in the choice. So now aim of the day, there is imminent need of surgery, need of necessary training programs designed for improving the skills of general ophthalmology, especially working at district levels, so that burden on tertiary care centers can be relieved. And for that, arranging regular workshops, which is PICO is doing very well in the current dynamic leadership of Professor Sanaullah Johnson. And continuous, another recommendation, that continuous medical education. There should be a 1 month rotation in the different tertiary care department of pediatric ophthalmology for district ophthalmologists are working in district surgical hand-on training so that load on tertiary care hospitals decrease. Moreover, young ophthalmologists must be encouraged to for doing fellowships in pediatric ophthalmology so that more skilled people can join this specialty. There should be a joint ventures with OPS and Gynae and pediatric department so that parents should be educated about advantages of early screening, thus making sure that their child lives a fully capable life. Take home message is that pediatric cataract is one of the leading cause of childhood blindness and thus immediate treatment must be advised to the parents of the child to prevent lifelong disability.
Thank you very much.
Thank you.
So